Heart disease remains the leading cause of death worldwide, claiming millions of lives each year. This startling fact highlights the critical importance of understanding and recognizing the early symptoms of a heart attack. Early intervention can drastically increase survival rates and prevent long-term health complications, making awareness not just helpful but essential. Many people often mistake heart attack symptoms for less serious health issues like indigestion or anxiety, which can delay crucial medical attention. This misconception underscores the need for heightened awareness and education. Recognizing the signs of a heart attack goes beyond the commonly known chest pain or discomfort. It includes less obvious symptoms like unusual fatigue, dizziness, and even flu-like feelings. By debunking common myths and clarifying the wide range of possible symptoms, we can empower individuals to act quickly and seek medical help, potentially saving lives. This video will explore 15 vital symptoms of heart attacks and heart disease, aiming to equip you with the knowledge to respond swiftly in a critical moment. Number 1. Chest discomfort or pain. Chest discomfort or pain is one of the most recognizable signs of a heart attack and is crucial not to ignore. Often described as a sensation of pressure, squeezing, fullness, or sharp pain, this symptom typically manifests in the center of the chest and can vary in intensity and duration. It may last for more than a few minutes, disappear, and then return, sometimes feeling mild and at other times severe. This discomfort might feel like severe indigestion, but is distinguished by its location and the sensation of pressure rather than a burning feeling. The pain can also radiate outward from the chest to other parts of the upper body, including the arms, back, neck, jaw, or stomach, making it essential to pay attention to the overall context of the pain. Immediate medical attention is crucial if this symptom is experienced, especially if it's accompanied by other symptoms like shortness of breath, nausea, or dizziness, as these can indicate a more severe condition. Number 2. Shortness of breath. Shortness of breath, medically known as dyspnea, is a significant warning sign of a heart attack that can occur with or without chest pain. This symptom often manifests suddenly and may feel like an inability to catch your breath or a deep, wrenching need for air that isn't satisfied by breathing. In the context of heart disease, shortness of breath occurs when the heart is unable to pump blood efficiently, leading to an accumulation of blood returning to the lungs, which in turn causes fluid buildup and pulmonary congestion. This symptom can arise while resting or during physical activities. In some cases, people experience shortness of breath days or even weeks before a heart attack, making it a critical early indicator. It's especially crucial for individuals who notice a new or dramatic decrease in their exercise tolerance or find themselves gasping for air after simple activities like walking or climbing stairs to seek immediate medical attention. Early detection and treatment can significantly improve outcomes in heart-related conditions. Number 3. Cold sweat. Cold sweat or diaphoresis in the context of heart health is a less obvious but critical symptom of a heart attack. This phenomenon involves sudden and excessive sweating without the usual triggers like heat or physical exertion. Cold sweat during a heart attack is typically a response to stress perceived by the body, signaling an underlying issue such as blocked blood flow to the heart. This symptom can be particularly alarming when it occurs concurrently with other signs of a heart attack, such as chest pain or shortness of breath, but it may also appear independently. The sweat is often described as clammy or cold, making the skin feel unusually moist despite a lack of heat or activity. It's essential for individuals experiencing this symptom, especially if it is unexplained or accompanied by feelings of discomfort or nausea, to treat it as a potential medical emergency and seek immediate care. Recognizing cold sweat as a warning sign can be life-saving, prompting faster response and treatment. Number 4. Nausea or vomiting. Nausea or vomiting can be unexpected indicators of a heart attack, particularly in women. These symptoms might seem more commonly associated with digestive issues, but when linked to heart health, they often occur due to the reduced blood flow to the heart. This can interfere with the proper functioning of digestive processes, leading to feelings of nausea or an upset stomach. The experience of nausea or actual vomiting during a heart attack can be misleading and often leads individuals to dismiss the severity of their condition, attributing it to food poisoning or a gastrointestinal problem. However, when these symptoms are accompanied by other signs like chest discomfort, shortness of breath, or cold sweats, they should be taken very seriously. It is crucial for anyone experiencing these symptoms unexpectedly and without a clear cause to seek immediate medical attention. Early intervention can be crucial, particularly if these symptoms are part of a broader pattern indicating cardiovascular distress. This can potentially prevent the heart attack from escalating further. Number 5, dizziness or lightheadedness. Dizziness or lightheadedness associated with heart attacks is caused by insufficient blood flow to the brain due to a failing heart pump. This symptom can present as a feeling of being about to faint or an unsteady sensation, which may occur suddenly or accumulate gradually. Such episodes can also be accompanied by a feeling of weakness or a spinning sensation, though the latter is less common in heart-related conditions. Dizziness is particularly concerning when it happens without a clear reason, such as standing up too quickly or dehydration. When linked with heart health, it often signals that the heart isn't pumping blood effectively, which could be due to a blockage or a malfunction within the heart itself. This inefficiency can be critical, especially if the dizziness is paired with chest pain, breathlessness, or irregular heartbeat. Individuals experiencing these symptoms are advised to treat them with urgency, sitting or lying down to prevent falls and seeking immediate medical help. Recognizing and responding to this sign can prevent severe consequences, including full-blown heart attacks. Number 6, unusual fatigue. Unusual fatigue related to heart disease is a subtle but serious warning sign, often manifesting as an inexplicable tiredness that isn't relieved by rest. This type of fatigue can be particularly profound and debilitating, significantly impacting an individual's ability to perform routine tasks that previously posed no challenge, such as making the bed or taking a short walk. This symptom arises because the heart is struggling to pump blood efficiently due to blocked arteries or other heart problems, leading to decreased oxygen supply to the muscles and organs, including the brain. The body's response is to feel fatigued or exhausted as it tries to conserve energy. Especially crucial is the observation that this fatigue often appears well in advance of other, more recognizable symptoms like chest pain. Therefore, if you experience sudden, unexplained fatigue, particularly if accompanied by other symptoms like shortness of breath, dizziness, or chest discomfort, it's important to seek medical evaluation promptly. Early detection and treatment can significantly improve the management of potential heart-related issues. Number 7, pain in the lower chest or upper abdomen. Pain in the lower chest or upper abdomen is a symptom of heart issues that can often be mistaken for less serious conditions like heartburn, indigestion, or stomach ulcers. This type of pain usually manifests as a sharp burning or aching sensation that may be persistent or intermittent. It is particularly important to pay attention to this symptom when it appears suddenly and is not clearly linked to dietary habits or other identifiable causes. The pain occurs because the heart may not be receiving enough oxygenated blood due to a blockage in the coronary arteries, which can cause discomfort in areas other than the typical central chest location. This misplacement of pain can lead to delays in seeking treatment because the pain is often confused with gastrointestinal issues. Anyone experiencing unexplained pain in the lower chest or upper abdomen, especially if it is accompanied by nausea, sweating, or a feeling of general malaise, should consider it a potential sign of a heart attack. Prompt medical attention is crucial, as early diagnosis and treatment can significantly improve outcomes in cardiac events. Number 8, upper body pain. Upper body pain is a significant symptom of heart disease that can manifest in various forms and locations, including the arms, shoulders, back, neck, jaw, or upper stomach. This pain or discomfort may not always be intense and can be misleading, often resembling muscle strain or tension. However, its connection to heart issues arises from the heart's inability to receive adequate blood flow, which can cause referred pain to areas supplied by nerves that originate from the same spinal segments as the heart. This symptom can occur independently or in conjunction with chest pain, but its presence without typical chest pain is particularly noteworthy in women. The pain might feel like a dull ache, a sharp stab, or a persistent throbbing, and it can worsen with physical exertion or stress. Individuals experiencing such symptoms, especially when they are unusual for their normal health status, should take them seriously as potential indicators of a heart attack. Immediate consultation with healthcare providers is recommended to rule out cardiovascular causes, as early intervention can be crucial for preventing more severe cardiac events. Number 9. Irregular heartbeat. An irregular heartbeat, or arrhythmia, involves changes in the rhythm or speed of your heartbeat, which can be experienced as a fluttering, racing, or unusually slow heart rate. This symptom of heart disease is significant because it may indicate an underlying condition like atrial fibrillation, which can reduce the heart's efficiency and increase the risk of clot formation, potentially leading to a stroke or heart attack. Arrhythmias can occur due to various factors affecting the heart's electrical system, including ischemic heart disease, where the heart muscle doesn't get enough blood and oxygen. Other potential causes include electrolyte imbalances in the body, changes in the heart muscle, or the effects of medications. People experiencing an irregular heartbeat often describe sensations of a skipped beat or an unusually strong heartbeat that can appear suddenly and be intermittent or continuous. It's crucial for anyone who notices these changes, especially if accompanied by dizziness, shortness of breath, or chest pain, to seek medical evaluation promptly. Recognizing and treating an irregular heartbeat can prevent more severe health complications and improve overall heart function. Number 10. Swelling. Swelling, also known as edema in the context of heart disease, typically affects the feet, ankles, legs, or abdomen. This symptom occurs when the heart is not pumping blood effectively, leading to fluid accumulation in the body's tissues. The inability of the heart to maintain adequate blood flow causes blood to back up in the veins, increasing pressure within the blood vessels and forcing fluid out into the surrounding tissues. Swelling related to heart problems is most apparent in the lower parts of the body due to gravity's effect on fluids, making it noticeable in the legs and feet by the end of the day or after prolonged periods of sitting or standing. It can also manifest as abdominal bloating or swelling if the fluid accumulates in the abdominal cavity, a condition known as ascites. It's important for individuals experiencing unexplained or sudden swelling, especially if it's accompanied by symptoms like shortness of breath, fatigue, or weight gain, to seek medical attention. These signs can indicate worsening heart function, and early intervention can be crucial in managing the underlying heart condition and preventing further complications. Number 11. Coughing or wheezing. Coughing or wheezing in the context of heart disease often indicates heart failure, where the heart struggles to meet the body's needs for blood and oxygen. This condition can lead to fluid buildup in the lungs, known as pulmonary edema, which irritates the lungs and airways, causing respiratory symptoms. When the heart is not pumping efficiently, pressure in the pulmonary veins increases and fluid seeps into the lung tissues. This fluid accumulation can lead to a persistent cough or wheezing, a whistling sound that occurs during breathing, typically when exhaling. The cough associated with heart conditions is often worse when lying down due to increased pressure in the chest, and may be accompanied by white or pink blood-tinged mucus. It's crucial for anyone experiencing unexplained coughing or wheezing, particularly if these symptoms are combined with other signs of heart failure like shortness of breath, fatigue, or swelling, to consult a healthcare provider. Identifying and treating the underlying heart condition early can help manage symptoms and prevent further health deterioration. Number 12. Silent myocardial infarction. A silent myocardial infarction, commonly referred to as a silent heart attack, occurs when a person experiences the death of heart muscle tissue due to a lack of blood supply, but without the typical symptoms associated with a heart attack. These silent events are particularly dangerous because they often go unnoticed and untreated. People with a silent myocardial infarction do not experience the classic symptoms of a heart attack, such as chest pain, shortness of breath, or cold sweats. Instead, they might only feel a mild discomfort that doesn't necessarily seem related to the heart, or they may have no symptoms at all. This makes it easy to dismiss or overlook the event, increasing the risk of further heart damage or another, potentially more severe heart attack in the future. Silent heart attacks are more common in people with diabetes because neuropathy, a common diabetic complication, can mask the pain of a heart attack. Anyone at risk of heart disease, especially those with diabetes or a history of heart issues, should have regular medical checkups that include heart evaluations. Detecting a silent myocardial infarction early through routine testing can be crucial for preventing further cardiovascular problems and managing heart health proactively. Number 13, extreme anxiety. Extreme anxiety, when related to heart disease, is not just a psychological condition, but can also be a physiological response to cardiac distress. In some cases, extreme anxiety can manifest as a symptom of a heart attack, often described by patients as a sudden feeling of doom or severe fear that is hard to explain. This intense emotional state can be the body's reaction to the stress of heart dysfunction. Physiologically, when the heart is not pumping efficiently or if there is a significant blockage, the body might react by triggering an anxiety response. The adrenal glands release hormones like adrenaline, which can cause a surge in heart rate and blood pressure, exacerbating feelings of anxiety and stress. People experiencing extreme anxiety along with other symptoms, such as chest discomfort, shortness of breath, or unexplained sweating should treat these signs seriously and seek immediate medical attention. Recognizing that these psychological symptoms can have a physical cause related to heart health is crucial for timely and effective treatment. Number 14, paleness or pallor. Paleness or pallor in relation to heart disease is a symptom that can indicate a reduced blood flow or lower oxygen levels in the blood, both of which may be due to heart problems such as heart failure or severe heart attack. When the heart is unable to pump effectively, less blood circulates through the body, which can lead to a noticeable lightening of skin color. Pallor might be especially evident in the face, lips, and fingernails, presenting as a stark contrast to one's usual skin tone. This change can occur suddenly during a heart attack or gradually as heart function declines. The skin may also feel cold to the touch, another indicator of poor blood circulation. The occurrence of pallor along with other symptoms like dizziness, shortness of breath, or chest pain should prompt immediate medical attention. It's crucial for individuals to understand that while pallor can be caused by various factors, in the context of other heart-related symptoms, it requires urgent evaluation to address potential underlying cardiac issues. Recognizing and responding to this sign can be critical in preventing more severe outcomes. Number 15, snoring or sleep apnea. Snoring or sleep apnea can be more than just a nuisance. It can also be a sign of potential heart health issues. Sleep apnea, particularly obstructive sleep apnea, OSA, involves episodes where breathing stops or becomes shallow during sleep. This condition forces the heart to work harder, which can lead to increased blood pressure and eventually heart disease. In cases of sleep apnea, the airway becomes partially or completely obstructed during sleep, leading to significant drops in blood oxygen levels. The body responds to these episodes by releasing stress hormones, which can exacerbate heart problems by increasing heart rate and promoting inflammation. Chronic sleep apnea can result in a higher risk of developing arrhythmias, heart failure, and even heart attacks. Individuals who experience loud snoring, observed pauses in breathing during sleep, or chronic daytime fatigue despite adequate sleep should consider a consultation for sleep apnea. Early diagnosis and treatment, such as using a continuous positive airway pressure (CPAP) machine, can significantly reduce the risk of heart complications associated with this condition. Recognizing the symptoms of a heart attack and heart disease is crucial, not only for your safety but also for your long-term health. Each of the symptoms we've discussed today can serve as an early warning system, alerting you to potential heart issues before they become critical. Understanding and responding to these signs promptly can mean the difference between life and death and significantly improve your chances of recovery. If you ever observe any of these signs, whether it's unusual fatigue, chest pain, or even symptoms like snoring and sleep apnea linked to heart stress, it's imperative to seek immediate medical attention. Don't wait or dismiss these symptoms, as early intervention is key in preventing more severe outcomes. Additionally, I encourage you to consult with a healthcare provider for a personalized assessment of your heart health. Regular checkups can help you stay ahead of any potential issues and maintain a healthy heart. Don't forget to subscribe to our channel for more informative videos like this one. If you have any questions or would like to share your experiences related to heart health, please comment below. Your story might inspire others to take their symptoms seriously and seek help. Together, we can raise awareness and encourage healthier lives.